Welcome back to part 6 of this 6-part series, Wendy Williams Health, breaking down the illnesses. If you have not subscribed to my channel, I don't know what you're waiting for. Please subscribe. Join the party. We're up to almost 700,000 subscribers. We give evidence-based medical information, and we still manage to have fun even when the topics aren't always funny. So come on, join us and hit that notification bell so you'll be among the first to know when I release new videos. I'm Dr. Frita. I'm an MD who is triple board certified. I am not Wendy Williams' doctor, and I am not privy to any more of her information than the general public, but I do know quite a bit about medicine, and I love sharing what I know with you, which is what I'm about to do right now in part 6. What is addiction? I'm addicted to you. I'm addicted to... I don't know why I keep doing that. If you've been watching the docuseries, Where is Wendy Williams? You see that her addictions keep coming up. Now, way prior to this docuseries, Wendy Williams, in her best state of mind, has been open about her struggles with addiction. She shared that she has a history of cocaine addiction. She said that she has used marijuana. She didn't necessarily state that she was addicted to that, but people can get addicted to marijuana. I don't care if it's legal. It still has addictive potential, okay? And in the docuseries, we learn that she does have an alcohol addiction. So let's break it down. What is addiction? Addiction is when you can't control yourself or stop yourself from using something or doing something or taking something, even if you know it can be detrimental to your health or cause harm. It's a compulsive seeking and taking or using something, or a compulsive need to do a behavior, even if you know good and well that it's not good for you and you can see clearly, logically, the consequences. It may cause consequences to your physical health, your mental health, your financial well-being, to relationships, but you just can't control the impulse. Now, here's the thing. People used to think that if you had an addiction, it was just a sign of weakness. You didn't have the willpower. It was your fault. But now we know that's all wrong. Addiction is actually a disease. Yes, it's a brain disorder. There's a physiology behind it. And some people actually have a genetic predisposition. Am I making excuses? No. But do I have to make excuses for someone who gets cancer or multiple sclerosis or diabetes, or if they have a stroke? No, I don't have to make an excuse for a disease. Addiction is a disease. It's a brain disorder. So let's talk about it. There are 2 main groups of addiction: substance use, like if you're using alcohol, or behavior, like if you have a gambling addiction. And all forms of addiction are tied to the reward pathway. So this is how it works. In the reward pathway, if you perform a good behavior, if you do something that promotes your survival or well-being, you'll have a release of dopamine from your brain, and it makes you feel good. So if someone compliments you, or if you accomplish something really great, you run a marathon, it feels good and you have some dopamine release, okay? That's good, right? So here's what happens with certain substances, drugs, for example, like cocaine or cigarettes or alcohol. When you take these substances, they also release dopamine from that reward pathway. The thing is, they release much more dopamine than you can ever release from the natural reward pathway. You can't compete. So once you use a drug and you get all of this dopamine release, well, guess what? You might want it again. So to get it again, you have to use the drug or drink the alcohol again. And ooh, you get more of this dopamine. Ooh, you're feeling good, good reward. Well, after a while, your neurological system, your brain says, wait a minute, this is just too much dopamine being released. Let's decrease some of these dopamine receptors, okay? Let's decrease some of our reactivity to the dopamine. And while we're at it, let's decrease some of the amount of dopamine that's released from this 1 or 2 glasses of alcohol. So what happens? You might go back, you drink the same amount of alcohol that you drank before to get the dopamine release. But now your body has gained a tolerance to it. And so what do? You drink more alcohol. So once you drink more alcohol, well, now you may have passed a threshold where it's enough to get all that dopamine again, okay? You get that good feeling. But after a while, your brain says, let's back up, let's back up. Let's cut back again on even more of these receptors to the dopamine. This is too much dopamine. Let's cut back on more of the dopamine. So what do? You say, hold up, I want that same feeling. I used to drink 2 glasses of alcohol and that did it. Then 4, now it's taken 6. Oh, okay, I've got it. And so you've got this cycle of the reward pathway that you're chasing. You have a tolerance, so it takes more and more and more. And while you're taking more and more of a substance, it's causing not only mental health, but physical health problems. You're having a difficult time stopping the behavior, even if logically you know that it's harmful to you. This is addiction. It can happen to anyone. You don't have to be a weak person or you're just not built strong enough. No, you can look around at all of the people in possibly your lives who have addiction, people on television, highly intelligent people. It has nothing to do with that. It's a brain disorder. And I say that because I want to make sure that people understand when they're watching Wendy Williams, she's not a weak person. She's dealing with a brain disorder. So just like you wouldn't laugh at someone who had cancer, you wouldn't laugh at someone who had a stroke, you don't laugh or toot your nose up at someone who's living with addiction. And I've actually seen a lot of positive feedback. I find that more people than not are more sympathetic and empathetic toward Wendy. I've heard some people say, it's karma because Wendy talks about people all the time. Karma what? Who isn't a little bit messy? Who's perfect? I just love how all these people are casting stones as if they have no faults themselves. Anyway, back to the subject at hand. Addiction is rather common. Approximately 20 million people in the United States have a substance use disorder. So yes, there are 2 types of addiction, as I mentioned, the substance use and the behavioral. So let's talk about the substance. It can be any type of a drug, be it prescription or not prescription. It can be any kind of a substance, really, even if it's something that's not meant to be a drug, like glue. Alcohol is the most common substance use disorder in the United States, followed by nicotine and marijuana. Some other substances that can cause addiction or substance use disorder include cocaine, crack is whack. Do y'all remember that? Do y'all remember when Wendy Williams and Whitney Houston had it out because Wendy was all up in Whitney's business? Whitney cussed her out. Okay, but anyway, yeah, crack is one of the things that can cause addiction. Also, heroin, methamphetamines, prescription drugs like Percocet, Molly Percocet. Yeah, Molly as well, ecstasy. Ooh, y'all, make sure you watch my YouTube video on what is Molly after you finish watching this video. What else? Caffeine. Oh yeah, caffeine is actually a drug. It's really the most commonly used drug in the world. Caffeine can cause addiction. Do you ever get a headache when you don't use caffeine? Barbiturates, benzodiazepines, things like Xanax, hallucinogens, LSD, PCP, vapes. Yeah, vaping can be addictive. We know that Wendy had Sean and the driver driving all around trying to find her vapes. And then she got confused because she forgot that the vape shop really was the vape shop. Anyway, yes, vaping can be addictive. So that's substance use disorders. The other group, behavior. Yes, they're behavioral addictions. And I want y'all to listen because this is about to hit home with a lot of people. Here are some of the behaviors that can cause addiction. Gambling, eating, shopping. Yeah, being a shopaholic is not just a joke. Shopping can be addictive. Shoplifting. Haven't you ever heard of people who have the means, they have money, and then they steal stuff, silly stuff, little stuff, pack of gum, something they can afford. Gaming. Hello, any parents? Yeah, being on those gaming systems, when you pull your child's game or whatever kind of gaming system away and the child acts like he's going to have a complete fit and he falls out like a fainting goat. Yeah, gaming can be addictive. The behavior of sex can be addictive. Yeah, that's a real thing, sex addiction. And using the internet can be addictive. Using your smartphone. Are you someone who can't go 2 seconds without grabbing your phone and seeing what's going on and seeing how many likes you have or how many? Yeah. Reward pathway. That can be an addictive behavior. Comment below if any of these potential addictions I mentioned surprised you. Some signs or symptoms that you may be addicted to something would be if you have the inability to stop, even if you tell yourself, okay, I'm not going to do it, you go ahead and do it. if you become preoccupied with it, you're always thinking about it, you're always kind of planning or seeking how you can get to the substance or do the behavior, if you feel guilty, and if you're also changing your behavior with your loved ones, if you're lying to them or if you're trying to hide the behavior, if there's shame around the behavior, these could be some hints that you have an addiction. If you feel a loss of control. So if you suspect that you have an addiction, or if you suspect a loved one has an addiction, you definitely want to consult your primary care physician, also your mental health provider, or even a substance abuse specialty clinic or program. If you're someone who suspects that a loved one has an addiction, please make sure you're not judgmental. Make sure you go in with empathy. And if you're trying to stop someone from using a substance, alcohol, for example, be careful because you really may need professional help. If someone has had a chronic or long-term use of alcohol and you just stop it cold turkey, you can cause some life-threatening withdrawal symptoms. You can lead them to go into delirium tremens, which those are a set of symptoms that usually will kick in about 2 to 5 days after you stop cold someone who's had chronic heavy use of alcohol, and they can have a heart attack, they can have a stroke, they can even die, okay? Some other withdrawal symptoms from alcohol include fast heart rate or tachycardia, fever, you can get the shakes, a tremor, seizures, nausea, vomiting. Same thing with heroin, okay? Some of the narcotics. If you are stopping the heroin all of a sudden, or you're stopping the narcotic, you'll need professional help because it can cause medical issues. Some of the opioid or heroin withdrawal symptoms include diarrhea, dilated pupils. You can get fever, you can get nausea, vomiting. Certainly you can get anxiety. You can get really fast breathing or tachypnea. It's a medical issue. So make sure you don't just do it alone if you're going to stop cold. You can have inpatient treatment. They have sober houses. There's all kinds of help available. And then there's AA or Alcoholics Anonymous, as well as NA, Narcotics Anonymous. And there's something called Al-Anon. Bottom line, I just want to drive home the point that addiction is a disease. It is a chronic brain disorder. It should be taken seriously. Certainly, it's not to be laughed at. It's not to be judged. And it sounds like, according to what we heard in the docuseries, that Wendy Williams is getting the help. And so I'm wishing her the best, wishing her all of the physical and mental health, all of the love, the support, and that she's actually around people who care for her and who have her best interest. If you found this information to be helpful and informative, please be sure to like this video, to share this video, to subscribe to my channel, and to hit that notification bell. I will keep bringing you evidence-based medical information that's easy to understand. I'm Dr. Frita.